so I would love to stay here and raise a family, but the way things are looking, my license on the line is on the line.
Yeah.
Every time I come to work when I'm low staff. I love the people I work with. My coworkers are amazing. My manager, direct manager from both units were amazing. The people I work with care so much. It's the upper management, and they've known about this for months.
Okay.
And my first year on Med-Surg 3, and pretty much every shift on the night shift, my first year during COVID, we filled out an ADO because of lack of staffing, losing our float pool, sending all of our aides to sit instead of hiring people to sit, particularly. We had falls, there were so many issues of people
injuries.
Patients sitting in their own, incontinence with brown stains on the sheets. Who knows how long they've been changed. I went to the ICU in September of last year. And what was happening once I got my groove and everything, we are not a locked unit in the ICU, and because ICU trained nurses are able to work in any acuity in the hospital, minus surgery, they float us.
Okay.
And so when you're not locked, you get floated. And so since then, we've been, especially when the travel contracts ended a few months ago and all the travelers left, it became very, very unsafe, and we haven't had supplies for so many different types of supplies. For instance, our ice machine in the ICU has been broken since February. And so what I do when I come on shift, before I get report, I come early, I see if there's any ice from the kitchen, and if not, they close at 7 p.m. I go downstairs to grab ice, because if we have patients that are getting fevers and we want to put some ice packs on them, we have to go to another unit. And then those ice machines are broken because everyone's trying to get ice out of those machines because their ice machines are broken. And so it's just really dangerous to leave the unit.
It's not like they need ice for drinking water.
Also, patients do drink water. And so we need to go to the other kitchens to get those ices.
Oh, I see.
2 days ago,
okay,
I was floated to the PCU at 1800. I was told that I was to take 4 patients, a full load, at 1800 until 2030, until 8:30 p.m. At that time, when the break nurse showed up, I was to give them all the 4 patients and then go to Med-Surg 3 to then get 5 patients on Med-Surg 3. So they floated me not once but twice, and then they told me that at 5 o'clock I had to go back to the PCU when the break nurse left to take back over those 4 patients, and the charge nurse on Med-Surg 3 was going to take those 5 patients, even though they were over census, because there was 11 patients, 1 charge, and 1 nurse in the Med-Surg 3. So if I were to have left my 5 patients in Med-Surg 3 at 5, the charge nurse would have had 6 patients to care for as a charge nurse, and the other nurse would keep their 5 patients. But because I found that out right away, the nurse that I got report from in the PCU, who was coming off her shift, found out about what was going on and called the house supervisor to request, for the patient's sakes, for her to come in early at 5 in the morning so that we didn't have to transfer care 1, 2, 3, 4 times in 14 hours.
Wow.
It's against union contracts, is what I understand, to be floated 3 times.
Okay.
And they tried to do that to me 2 days ago. One of my patients in those first 2 hours while I was on the PCU needed a medication that required me to measure out exactly 1.5 milliliters for a very high-risk medication. We have not had 2 milliliter or 3 milliliter Lure-Lock syringes for months. And the 10 milliliter syringes we have, you can't accurately measure 1.5 milliliters. And I happen to use my energy to ask people to watch my patients while I went over to the ICU, and I found the last 3 milliliter Lure-Lock syringe to properly measure 1.5 milliliters.
So
it's very unsafe.
Compounding problems.
Yes.
Supply chain problems.
And those are easy things, 3 milliliter Lure-Locks.
Okay.
Simple.
Yeah.
Running out of central line dressing kits and having to use other dressing kits because there's no other dressing kits to properly change the central line dressings.
Yeah.
It's high risk infection.
Wow.
And it's happened where we run out of dressing kits, and the house supervisor might not have time, due to being over inundated or trying to shuffle everyone around, to go down to the storage unit to find one of those. We have times where ICU nurses are floated off to other units, and new grads, ICU new grads, they're great, but they're not allowed to float because they're new grads. And so we will have, a couple months ago, we had very high acuity patients come in through the ED, And because all of the more experienced ICU nurses, I'm only barely just under a year experience.
Okay, yeah.
They got floated to other units because they had to,
Yeah.
and the new grads had to take these very high acuity patients, or they would have to fly them out to other centers.
And you're referring to an emergency room situation?
Emergency room patient that needed to go to the ICU, but there wasn't any nurses to work to take those patients because they were floated to other units because we don't have staffing. Ever since I started working here 2 years ago, and it's a non-profit hospital, and yet they have all these quotes about, you know, Jesus loves you and all that. But if they really cared about what Jesus cared about, then they would make our patients more safe by giving us more staffing, by incentivizing travelers to come with competitive wages, and by incentivizing nurses who've been working here, who live here, who have their families and their homes here, who can't afford to leave the area to find safer places to work.
Yeah.
And so it's really hard for the people who are here for their life careers, because they can't just pick up and leave.
Right.
And they suffer, and they risk their license every day when we're understaffed.
Yeah.
And that's all I have to say.
Okay, thank you.
I just worked a 14-hour shift.
So you're out here
and I'm staying up late
14
for my night shift. I had to work a little overtime. It was a little hard night for me.
Yeah.
But I have to cover myself too by making sure I chart all the things properly of all the interventions that I do. And it wasn't a low staffing issue necessarily, but one of our nurses last night in the ICU had to get floated to another unit. And then we lost our break nurse for a little bit, and so we had someone on the day shift stay over in order to help us have some breaks, because we do need breaks.
Yes. I mean, a 12-hour shift without breaks, as we heard someone say earlier, is brutal.
It's very, very hard.
Yeah, very
Especially
hard.
when your patients, you know, you can't necessarily walk more than 5 feet without having someone else who has the same skill set to watch for you. And when that person also has to, like the charge nurse, for instance, also has to watch everyone else in their unit, it just makes it unsafe.
Yeah.
And so I would love to stay here and raise a family, but the way things are looking, my license on the line is on the line.
Yeah.
Every time I come to work when we're low staff. I love the people I work with. My coworkers are amazing. My manager, direct manager from both units were amazing. The people I work with care so much. It's the upper management, and they've known about this for months. Travelers' contracts they cut. I don't know what was going on with the COVID federal grants to give competitive wages to travelers.
Right.
But I think something ended a few months ago, and all the travelers left for better wages elsewhere. And the patients at this hospital, Humboldt County, suffer. And that's all I have to say.
Thank you so much for your input. I really appreciate that. We'll take a couple of photos of you.
With my dogs?
Yeah, sure. Absolutely. We love dog protesters are the best.
Hey, cheer up. Cheer up.
Hi, guys. Smile for the camera, babies.
Say hey, Cora. Say hey, Moby.
Hey, Moby.